Welcome back to Learning Anatomy with Dr. Bakari. Let's look at the reason why the sense of smell decreases with age. The loss of the sense of smell is anosmia, and this has been seen to reduce as we age. And this is more intense after the age of 70. And it is basically attributed to the loss of the olfactory nerve rootlets. There are also other causes that could lead to the decrease in the sense of smell, and these include cold or allergy that will cause an inflammation or irritation of the olfactory segment. You could also have a loss of smell from infection, especially in the sinuses. Infections in the sinuses, which are paranasal sinuses, can spread and invade the nasal segment, and this can also disrupt the process of olfaction. Also, neurodegenerative diseases like Alzheimer's and Parkinson's disease have been reported to affect the sense of smell, because these diseases also affect the olfactory apparatus. Drugs and also toxins have also been reported to affect the sense of smell. Drugs like antibiotics or antidepressants have been shown to have effect on olfactory function. Also, toxins like pesticides, also addiction to some kind of drugs like cocaine or heroin have also been shown to affect the sense of smell. We also have effects or damage on the sense of smell when we have injuries or impact during accidents affecting the olfactory structures. These are the other factors that can affect the sense of smell. But for this class, we would be focusing on why the sense of smell tends to reduce as we age. And we'll be using this slide to answer this question. Basically, we have the olfactory segment, which of course is a sub-region of the nasal cavity. If you look at this image here, this is where we have the nasal cavity. The olfactory segment here, which is this region here that is carved out, is of course the superior part of the nasal cavity. And this segment is where we have the process of olfaction being initiated from. Around this region, we have a number of cells. If you try to extract this region, this is the kind of configuration that will be seen at this other part. So if you look at this image here, you see that we have a number of olfactory cells that are destined or programmed for specific functions. So we are going to be looking at each of these cells, and this is what we use to provide answers to our question. So the first cell that we have the olfactory epithelium. This is also referred to as the olfactory sustentacular cell or the neural supporting cell. And just as the name implies, they're actually supporting the olfactory segment. And this is what is harrowed here in yellow. They are basically pseudo-stratified columnar type of epithelium. And this is what forms like the background of the olfactory segment. Within this olfactory epithelium, we have the olfactory receptor cells. These are the olfactory sensory cells, and these are the cells that are specifically designed for olfactory function. And this is the cell here, harrowed in red. They are bipolar neuron, which means that they have two axonal extensions from the cell body. And this is the morphology of the olfactory sensory cell. This is the cell that is specifically designed for olfactory function. So you see it sandwiched within the olfactory epithelium that helps to give structural support to this cell. Then another type of cell that is seen within the olfactory segment are the basal cells. These cells are also referred to as the stem cell or the progenitor cells. These cells basically are progenitor cells because they are seen to be transformed into the olfactory sensory cell or the olfactory receptor cell. Remember, we described the olfactory receptor cell as the specific cell that is responsible for olfactory function. So this is where we have the basal cell here, harrowed in black. This is the cell that will later be transformed into the olfactory sensory cell. So why is this transformation needed? Basically, the olfactory sensory cell have short lifespan between 30 to 60 days. And because of this short lifespan, they are needed to be replaced. So it is this basal cell that has seen to transform into the olfactory sensory cell or the receptor cell. This process of transformation cannot be 100% efficient because the total number of olfactory sensory cells that will be lost cannot be fully replaced. So this process cannot be fully compensated for. So as this process goes on, as we age, it tends to reduce the number of olfactory nerve rootlets. This is what is responsible for a diminish or a decrease in the sense of smell as we age. Because as this process of replacing the worn out olfactory sensory cell by the basal cell, the total number of olfactory cells that will be lost will not be fully replaced. And this is why the sense of smell tends to reduce as we age, especially around 60 to 70 years of age. So thanks for watching this video. Let's continue to stay glued to this channel.